My name is Dr. Ashleigh Smith. I'm a Henry Brodati Research Fellow at the University of South Australia. So currently in Australia we have about 500,000 people living with dementia. So by 2056 we'll have 1.1 million people living with dementia. Of that statistic, 330,000 people will be living outside of major cities. What we need to understand is how both modifiable and non-modifiable factors cluster differently in people who live in rural Australia versus people who live in urban Australia. The Dementia Australia Research Foundation funding is really important for our research group. What it's going to allow us to do is move our research questions from major capital cities and actually embed our researchers in rural and regional Australia. From there, we'll be able to make really strong connections with people who live in those towns and the local community to develop rurally focused dementia prevention strategies and resources. This project is going to consist of three main phases. Phase one of our project is really about looking at individual lifestyle factors, but that only gives us a really small piece of the puzzle. What we need to do is we need to consult with the different communities to understand at the community level what that entire ecosystem looks like. So what's working well in rural and regional Australia and what we might need to focus our research on. One of the examples for that could be there's no point us implementing rural walking interventions if everybody in that rural town all live on a major highway, because it's just not safe for them to be able to engage in that activity. What we then need to do in phase two is to understand at the entire community level what's working well in regional communities and where does the focus need to be. Then in phase three, what we really need to do is we need to work with older adults, we need to work with people from rural communities to develop rural specific dementia prevention strategies that are both contextually and geographically appropriate for those regions. We plan to get groups of older adults, of aged care providers, of local council members, all together around the table to talk about which resources are appropriate, what might need modifying for different communities in order to come up with a toolkit that different rural communities will be able to pick and choose what's relevant for them. For example, it might be a factor of working with the local aged care facility and their local gyms around implementing community gym programs. So one really important component of our research is translating that for the general public. We've learnt over the last few years that it's really important to be able to present these messages, and one way that we've started to do that is by working with communicators. So for example, Christina Hager, who works in community radio, she's been working with us to understand how we get our message of dementia prevention out to the people who really need it.
I think Ash's research is a very sophisticated model because it is actually working with the people who will utilise the research to maximise the return on investment, to maximise the positive changes in people's health dealing with dementia. I think what I really like with Ash's work is that she understands the importance of working with the people from policymakers at the local district council area through to the health professionals, through to the consumers, finding out with them, working with them, what are the local issues, what's going to work, what's already working and what can be done better. That's, I think, what steps it apart.
The perfect outcome for us is to be able to establish research teams that live and work in rural and regional Australia. What we're hoping from this project is we'll be able to develop strategies, but in the future we're hoping to be able to work with rural communities to start to develop personalised interventions.